According to the words of Joseph Borrell, COVID-19 will reshape our world. We don't yet know when the crisis will end, but we can know for sure by the time it does, our world will look completely different. Hello and welcome to COVID Shorts, a Foster Feed series of 4 episodes concerning the second wave of COVID-19 pandemic which has already hit India. These days, the internet is filled with information regarding the COVID-19 virus and the do's and don'ts that are needed to be followed. Though some of the informations are relevant, a major portion of it is either unverified or unscientific. That is why I wanted to bring to you informations which are both authentic and pertinent to the current COVID scenario. Because these are trying times, times when you should trust no one but the best. So, to answer your most frequently Googled questions about this pandemic, in all the 4 episodes of this series, we will have one of the very respected doctors and one of my favorite professors from college, Professor Dr. Abhishek Ghosh, sir, with us.
Hello, sir. Welcome to Foster Feed. Thank you for taking out some time and doing this video for us. Sir, West Bengal has recorded over 17,000 cases and India has crossed 3 lakh 60,000 cases in the past 24 hours. So,
Yes,
what
yes.
is your thoughts on the current situation?
So yes, we are passing through a very hard times, and as the cases are exponentially increasing, and I think these cases are actually less in number because nowadays testing takes report take comes longer time to arrive, and often we have to there is a waiting time of 72 hours also after getting test, and also test kits are not available adequately. So I think this number is little bit less than the actual number. Um, so what to prevent this, at least we have to just we have to pray. Actually, there is no as there is no lockdown here in the state also, at least. So there is always chance of increasing the infection rate, and also morbidity mortality is also going to high. So we have to keep ourselves safe as far as possible. We have to maintain the safety measures as far as possible and avoid the going to the crowded place, avoid going to the close to the COVID patients as far as possible. I'm not saying that you have to close yourself within one room. That is not possible for all, especially for the working persons. But as far as possible, try to go unnecessary crowding. That's and maintain the social, normal hygiene, and use the double masks and sanitizers. That is going to help you. Don't get panic, and keep save emergency numbers for oxygen as well as for hospital admission, because all are having high demand now.
Sir, what are the strains of coronaviruses causing the infection at present?
So virus constantly change through mutation, and new variants of a virus are expected to occur over time because they are also try to survive in this world, and just like they are also have some adaptations which thus they can survive well. So multiple variants of the virus that causes COVID-19 have been documented in the US as well as in globally. And the virus that causes COVID-19 is a type of coronavirus that are named for the crown-like spikes on their surfaces. And scientists monitor changes in the virus, including changes on the spikes. So there are multiple variants of the virus that causes COVID-19 are circulating globally, and there are currently 5 variants of concern in the United States. So there are some strains they are called variant of interest, some are called variant of concern, and variant of high consequences. So commonly causes mutations are some B117, B1.351, P1. So B1.1.7 that was initially detected in the UK, which we call it UK strain. B1.351 was detected in South Africa in December 2020, that we call South Africa strain. P1 initially infected in Brazil in January 2021. And far newer are B1.427 and B1.429. These two variants were first identified in California, and all are classified as variant of concern. So that means these variants seem to spread more easily and quickly than other variants, which may lead to more cases of COVID-19, and increase in the number of cases will put more strain on healthcare resources actually. So lead to more hospitalization, and that can be potentially having more mortality. So far studies suggest that antibodies generated through vaccination with currently authorized vaccines recognize these variants. So that is a hopeful thing, and this is being closely investigated, and more studies are actually underway. So there are two significant mutations in the spike protein, like E481 and LR452 is there, which we call it as a double mutant strain. So that is common in the India now. So double mutant strains, they have an increasing transmission rate, increasing chance of the morbidity and mortality. So we need to remember these two strains. And there is also possibility of the third mutant, triple mutant strain, which is discovered in the Bengal, but that is not so common in the other parts of the India. So due to this frequent mutation, existing vaccines may not work adequately in the recipients if they get this infection from the mutant strains. But so far the data about the Covishield and Covaxin are sufficient. Covaxin and Covishield is encouraging, because the persons who have got double dose vaccines, their infection rate is very much less, almost 0.04% and 0.03% for Covishield and Covaxin respectively, Covaxin and Covishield respectively. So try to vaccinate as early as possible. I know there is a shortage of vaccine, but those who are eligible, who are getting it, try to do it quickly, because that will give you protection against these mutant strains also, hopefully. So this is a hopeful thing, and we do not should panic about the mutations. That is quite common in the any life cycle of a virus, in actually because they try to also try to find their new way of getting making the infections. So don't get panic, get yourself vaccinated as early as possible.
So,
Mutation
what are the symptoms?
is symptoms. There are varying symptoms, especially
What is
this
the
year we find a lots of gastrointestinal symptoms. Often patients having diarrhea or abdominal bloating or pain. That is often the initial manifestation, and patient is having throat pain or cough after these abdominal symptoms. So if we previously abdominal symptoms were not so much common in at least 2020, but in 2021 abdominal symptoms along with the respiratory symptoms like blocking nose, dry cough, pain in throat, and of course respiratory distress are much more common this year. That's why there is a huge demand of oxygen, and often in healthy young patients they are having desaturation of oxygen and needing high volume of oxygen from the very beginning, from the very early part of the illness, and that's why this is a concern. We have to be very cautious about the early symptoms, so that treatment can be started early. Don't delay if it is simple abdominal discomfort or diarrhea also, because that can be the initial symptom of this COVID-19 in this 2021. And of course high fever is also very
symptoms?
common this year. Previously fever tend to stop within 5 to 7 days, but now this year I find that very high grade continuous fever is persistent for the 10 days or above, and patients are actually getting anxious. What is the reason for this fever? But actually we cannot give any special drug, because there is no special antiviral. Of some reduces the viral load, but there is actually, it is a uh, cure self can be cured by after antibodies are generated adequately. Before that, no drug is actually going to kill the virus adequately. So we have to wait, and we can keep adequate hydration. Fever can be treated with paracetamol only. Don't use any other NSAID, because it is a viral infection, and often can lead to some abnormalities in the bleeding, coagulation, etc. So don't use any other NSAID
So,
except
what
this.
are the modes of transmission of these viruses?
Yes, so modes of transmission have not been changed. It is same like previous years also. So it is
Is it
transmitted by the
possible
aerosols.
that these viruses are transmitted through the air?
Yes, there is some report is there, but actually, the truth is that if we maintain the distance of 6 meters and at least 2 feet, because it is not carried by the aerosols and not by the air. So I think so. Actually, if we can maintain the distance properly and we can use the mask, we can prevent our infection. Double mask is needed. So the processes which generate the aerosol significantly, like suctioning, incubation, ventilation. These are the processes. So and also bronchoscopy. So these are the processes which generate aerosols, and we have to be very cautious during this procedure because that can have better penetration to our system easily. So if we can avoid aerosol formation and if we can keep a distance with from those spaces, then we can better prevent the uh, getting the COVID infection from these sources.
Okay, sir. Thank you so much.
So, in today's episode, we got to know all that we needed to know about the COVID 19 virus. Share this video as much as you can for public awareness. Also, make sure to subscribe and hit the notification bell so that you do not miss the second episode, which is coming next Tuesday. Until then, stay safe, stay healthy.